there is something that you can do about this. It's nothing to be ashamed of. You can go see a provider. And I just want more men to know that there are other outlets out there outside of just medications and trying to find a quick fix for things. You can make long-term changes, and hoping to continue to spread awareness about that.
You're listening to the Pelvic Freak Show
with your hosts, Amanda Neary and Hannah Meyer. Hey, Pelvic Freaks. Welcome back to another episode of the Pelvic Freak Show.
Where you're freaks for us and we're freaks for your pelvis, baby.
Guys, we are so excited today. We have an extremely special guest on the pod. You may have heard us talk a lot about how there are not a lot of male pelvic floor specialists out there. And we're going to have one on the podcast today. I would like to formally introduce Jonathan Koborsi, who is a physical therapist and board-certified orthopedic clinical specialist. He works currently at Athletico in Andersonville, Chicago. John is one of a handful of male clinicians at his company focusing on male pelvic health, treating a variety of complex conditions, including chronic pelvic pain, post-prostatectomy, rehabilitation, and a variety of sexual health concerns. As one of the only LGBTQ plus clinicians in this specialty in the Chicagoland area, he's passionate about creating a safe, inclusive space for all patients while expanding access to an often overlooked care for men in the community. Welcome to the podcast, John.
I'm excited to be here.
We're so excited to have you.
We've literally been wanting a male pelvic health therapist on for so long, since we started this podcast. So this is kind of like us meeting our manifestation goal.
I'm glad to be here. Although I feel like I should not be, because men should not podcast, but
some queer men get a pass.
Yeah, there we go.
You do get a pass.
Also, it's just really cool that we're like three queer public health specialists recording an episode together.
Yeah, that's fantastic.
It's freaking awesome.
So wait, how did you hear about us again?
So the guy that I'm dating, he's really good friends with this girl named Lexi. And Lexi was like, wait, do you know these two girls? They have a podcast. I feel like this would be fantastic. You should listen to it. And so I did. And then I was like, you know what? I'm going to reach out.
Hell yeah.
And here we are.
I actually forgot you were a Lexi referral.
Lexi is a day one pelvic freak. That's for sure.
Day one pelvic freak. One of my besties. I love her.
Yeah, she's awesome. Yeah, so I'm glad we were able to connect.
That's great.
Well, Jonathan, can you tell us a little bit about yourself, about how you got here, about how you got into pelvic health, your journey, everything?
Sure. Yeah. So started in orthopedics and sports. Just moved from Houston, Texas earlier this year. So that's primarily what I was doing in Houston. But I was exposed, having patients that were requesting male pelvic health, male pelvic floor therapy from the urologist. And there was nowhere to take them. I tried to do as much as I could, but I could not find a referral for anybody to go anywhere. And so I felt super limited with that. And then I made the decision to move to Chicago and immediately was like, you know what, I want to do this too. So signed up for some courses and then started practicing. And it's been great. It's been a challenge. As y'all probably know, that every patient is absolutely different. And every patient that you have is a learning experience. And that's where we're at. So just taking it day by day, but it's been fun. It's
amazing.
Yeah.
Do you specifically only treat men for pelvic health, or do you treat everyone? What's it look like? What's your patient population?
Right now, specifically male identifying or male patients, primarily because I know there's a lot more access for women at this time, which is fantastic. Obviously, there was not that many years ago. And so there's a clinician I work with just at the North Clinic, and she treats female pelvic health as well. And so I just wanted to solely kind of work with the male population right now, because I know that it's a lot more limited. Yeah. So
is there a reason why you decided to go into pelvic health? Like, did you expect yourself to be here when you went to PT school? Or
I had no clue. Okay. No, absolutely not. I feel like in PT school, they barely touch upon pelvic health in general.
Yeah. We talk about that very often.
Yeah. It's like maybe half, at least for me, it was like half a day, half a class. We had a specialist come in, but it's for a few hours. And then I was like, there you go. Here's a little quiz you take at the end. And that's the section. And so, obviously I feel like for most of the research that's supported right now, there's more research for women, and which is fantastic, because I'm glad there's more research for that. But even then there was barely like a whisper of male pelvic health, anything. And so, I kind of just forgot that it existed. Unfortunately, as a man, forgot that it existed.
100%.
And then, until I started getting a couple patients that were requesting it, I was like, you know what? Why not? There's demand for it, and I would like to learn something new. And I took it upon myself to try to do that. So
important. Even like working in pelvic floor for a while now, we get so many therapists that aren't either educated in treating male identifying clients or don't want to because like they have a colleague who doesn't do it and they're like, okay, well, I'm like good at this one thing and I treat women and I'm just going to keep doing that. So at our practice here at the Pelvic Institute, we're gender inclusive. So we treat everyone.
that's fantastic.
We've had a couple therapists come on that like still needed to take male courses or do like rectal courses and things like that. But it's an expectation that everyone at least has that in their toolkit. Because it's really important that we're being more accessible. And we're always trying to find ways to like let male identifying patients know that we're here. Most people that are going to Google us are going to be female identifying, pregnancy, postpartum, things like that. So we're just always trying to get the word out there. So I think what you're doing is extremely important.
Yeah. And I like what you said too. Like, well, it's true. Male pelvic health it's like it's like pelvic health and it's okay. PT's here. And then pelvic health in general is like a tiny subset. And then it's like major women's pelvic health focus. And then it's like men's pelvic health is like all the way down here.
Yeah.
But then on top of that, when we're talking to like male pelvic health specifically, a lot of those symptoms are dismissed. Like I feel like most of the time when I get a patient in, they've been to like a billion urologists or other providers before they find me. And then
Exactly.
and then maybe they're feeling better after 3 visits is actually crazy.
Yeah, I would say that's to a T. A lot of the patients I get, I would say, are straight men right now, and they've seen the urologist, and the urologist has exhausted all things that they can do there, and so they're kind of like, well, you should probably go see a pelvic floor therapist. And so they Google until they find somebody, and then they come in. A lot of stress, a lot of anxiety about the situation that they're coming in for. At their wits' end of trying to find some help. And so stress and anxiety are like the 2 biggest things that they're experiencing. And a lot of it is just conversation that I find, like just talking to them about what they're feeling, their symptoms, seeing, what they've already done, what they could still do, yeah, it's a lot of Googling, trying to increase access and let people know, let men know that like, hey, there's other things that you can do. You already don't want to go to the doctors, right? We know that like men refuse to go to a healthcare provider unless it's like urgent. And so even at that point, they're probably not going to a urologist until it affects some sort of bowel, bladder function, sexual function. So it's at like the very end of them already not wanting to go see a physician. And then they go see a urologist and it's like, okay, somebody help me.
I'm telling you, men and not going to the doctor is such a thing.
That's so bad.
I literally talk about that all the time.
Yeah. I was actually going to clarify with you because you've probably already seen in a matter of months more male pelvic floor patients than I've seen in years, just by being in that specialty. Yeah. And I always preface it to people that ask about treating men. And I'm like, men don't come to pelvic floor therapy until it's involving their sexual function or their bladder and bowel. It has to get to that level for them to like really like research it, know that it exists because the information isn't out there too.
Correct. Yeah, no, absolutely. It's not until it's urgent or in their case, they feel like it's dire and they're like, you know what, I need to see somebody, I need to see somebody now. And so when I am seeing my male patients, it's a variety of things. Like, I wasn't even aware, I knew about, the lower GI system and how that can affect bowel and bladder function. But a lot of times people are coming in just with a variety of like lower GI symptoms. They're having some reflux, things of that sort, not able to have normal bowel movements, and they're just being referred by their GI or their urologist. They're like, well, you should probably go see a pelvic floor PT, and then that's it. So I'm sitting there like, okay, I didn't even know this was like, where do I start with trying to treat this? And so trying to piece these things together has been an experience, but it's been fun, and I've been able to help quite a few people, and so I'm excited to continue doing that. So.
That's awesome. What does a day in your life look like at an ortho practice where you're also seeing pelvic floor patients? No,
absolutely. Yeah. So right now I'm seeing my pelvic floor patients like one-on-one for an hour time, which I'm glad I'm able to block that off.
Yeah.
So I do have a private treatment room. We take them in, have a conversation. And so, usually just in terms of an evaluation, right, come in, just kind of, I have a blanket statement that I express, like, I know this is a very sensitive topic that can be uncomfortable to talk about, but I want you to know that this is a safe space. And there's nothing that needs to be hidden, especially with what we're discussing. We're going to get to know each other very well if we want to try to resolve your issues. And so just trying to build comfort even in the evaluation so that they can have open and honest conversation. And usually after 10, 15 minutes or so, then the word starts spewing. And that's the most important thing. It's just like, hey, I know you're already uncomfortable being here. You were uncomfortable seeing a urologist. You were uncomfortable trying to find a PT. We're here now. So let's make this happen. Let's figure out, why you're coming in, and we're able to get things done pretty quickly. So
got it down pat.
A question we get all the time is, do men have pelvic floors?
Of course.
And I'm sure you get that a lot.
And they know that they do.
They know.
Absolutely they know. And it's like, it's a joke, but it's like, of course you do, right? How are things moving the way that they're moving? How do you urinate? How do you have a bowel movement? How do you have sex? There are muscles and things down there that are helping you do that. And sometimes they work and sometimes they don't, just like any other muscle group in our body. And so we got to work on ways to fix that.
Yeah. And I will say you do have a calming presence, so I can see people being comfortable around you.
I appreciate that.
100%.
I try to.
Okay. Well, can you tell us about specifically, like, if you're specializing in LGBTQ plus care and what that's been like for you?
Yeah, that's...
Because you said most of your patients right now are straight, right?
I would say, yeah, most of my patients are straight. And I think within the LGBTQ plus community, we, in terms of, let's say, sexual dysfunction first, right? I feel like that's a topic that is already taboo for a lot of people to talk about, regardless of gender. And then within the LGBTQ plus community, trying to find ways to discuss the right and wrong ways to do things and potentially other tools to help you enjoy sex. And so what I was hoping to do, what I'm still hoping to do, is increase awareness and access for the LGBTQ plus community, for individuals to come in and be like, hey, I'm experiencing pain with this, pain with topping, pain with bottoming, pain with ejaculation and an orgasm. And how can I do something about this? It doesn't involve chemicals, we can say, or just something that you can get at a sex store down the street, which is not always bad, but there are other things that you can use. There are protocols for them, and they're a bit healthier for you. And there are ways that you can use those to help you enjoy and have pleasure with sexual activities. And it doesn't have to be chemicals. And I think that's been the biggest challenge so far. But again, still kind of diving into this field and trying to spread awareness about that. So I'm hoping to keep doing that through next year.
So do you feel like that's where you kind of want to go on your pelvic health journey?
Absolutely.
Okay, cool.
Awesome.
Especially being in Andersonville, I think that there's a lot of access there as well. And so, trying to just have conversations with some of the local physicians, but then also some of my patients that are coming in for other conditions. Like, sometimes, when you're seeing a patient, they mention a lot of different things and they mention other issues they might be having. Then having the conversation with them of, hey, there's other things you can do for this. There's pelvic floor PT, and then the ball gets rolling, and then either we start treatment with that too, or they come back.
It's an ongoing struggle here too, because I own this practice and I'm in the LGBTQ plus community. So I identify that on Google, and we say we're queer owned, all that, but it's another increasing advocacy. We're here because there's so much medical mistrust built into having those intimate conversations
and
with
medical
providers. Medical gaslighting. People, even the best intentioned clinicians can make a mistake or not have the right language around it. So getting patients comfortable sharing intimate details with us in that community can be more of a challenge.
Of course.
And then on the other side of it, it's really interesting. We talked about this with a sex therapist before. Because being in a same-sex relationship or any relationship within the LGBTQ plus community, there's that automatic built-in, we have to talk about sex in our relationship, right? Because it's not the heteronormative way that you approach having sex that we're conditioned growing up. So within partnerships, we often see better communication where it's okay, maybe I'm referring out to sex therapy less, but actually getting that rapport built from provider to patient is a longer road. So it's it's an interesting mix. And for any practice to just throw it in there should be special, or there could be special courses around this and having that language with patients too, I feel.
Yeah, no, I totally agree. I mean, like I said, I took a couple courses, you have an idea of what to do, but at the same time, to be frank, when I took the courses, I was the only male identifying patient in the course.
I was going to ask you how that was for you.
Yeah. So, you're doing internal and external exams, right? And so I was prepared for that. But, at the same time, walking to a room, it's 15 lovely women and then myself, and we're doing a male pelvic floor courses, right? And so fully aware that hey, this is supposed to be a safe space, right? We're all learning from each other. We're learning from our instructors. And at the same time, I am the only one here that has male male genitalia. And so, yes, you kind of got to throw away the awkwardness and discomfort away and just be like, you're working with your partner. But I was like, you know what, if you need me to be a test dummy, that's fine. Because that's part of this, right? You need to not just be able to identify, different anatomy here, but you also need to have conversations. And I think just trying to make people comfortable, including myself, with the conversations we're about to have. I was like, you know what, do what you need to do. I'm here. And so I do wish, though, in these courses, like you just mentioned, that there was more instruction on conversation and how to open up, conversation with patients, like for an evaluation and for follow-ups, like what to say and maybe what to avoid. Still learning that, right? I think it's still just a new thing for me, but definitely wish that they had more of that available.
Yeah. I'm also curious, and you can say as much or as little as you want to about this, but being in a larger physical therapy chain that primarily focuses on orthopedics and not a lot of these intimate details, like, do you find that your intake forms are inclusive enough for like your patients to really give you a full picture on what they're coming in for before you see them? Or is it more in the conversation you're having with them?
I think it includes quite a bit of information, but I would say for intake forms in general, they could probably be a little bit more broad and just allow patients to write in just whatever they feel as opposed to kind of checking boxes. But I usually don't even reference much of the intake form because I'm like, you know what, I'm going to have a conversation with you anyway. So thank you for filling that out. I appreciate it. I'm just going to look and see maybe a few things that you wrote and your main complaints, but at the same time, we're going to talk about it anyway. And so, do I wish they can be a little bit more just generalized and just allow people to write in more for sure. But always going to just have the conversation regardless of what the forms say.
Perfect.
Yeah.
I was going to say, back to you being in the pelvic health course, I'm sure all the pelvic health PTs were like, hell yeah, knowing how pelvic floor PTs are, but they probably weren't like openly like, yes, we have a man in our course. Because when I took the male course, we had no men in our course. So we were just like doing the best we could. So like for a lot of people, the first time that they're doing like any like rectal work or internal work on a male is their first patient that comes
that they see. I know.
Yeah.
And that's what I was like trying to be open in the course. I was like, y'all, if you need to, want you to be, everybody to be comfortable here, but I'm here. You know what I mean? So I know we're using dummies and we're using each other just to identify things, but like the partner I was with, she was fantastic. She was like, no, I'm glad I sat next to you because now you won't be the first person that I'm working with. That's a man. And so I was like, fantastic. I'm glad you feel that way.
Yeah, because how nerve-wracking is that to be like in a room with a patient for the first time and to be like, oh, okay, let's see how this goes, right? Like we know that we have the tools, right? But like still, like it's nice to have that practice beforehand. So I'm glad that we're having these conversations. Maybe we'll recruit more men into the force.
Hopefully.
That would be awesome.
Yeah, I don't know what men are scared of. At the same time, it's not like there aren't, gynecologists and various other healthcare providers that are treating both men and women, right?
Yeah.
And so, granted, I know everybody's comfort level with who their provider is different, and I want to acknowledge that. But that doesn't mean you can't learn a new thing, learn to help people in a different way,
Well, and I think that's a really good point because really it all starts with like PT school, right? Because people are going to PT school to be sports and ortho PTs. They don't even know that pelvic health is an option.
Not at all.
So we have a lot of people going into this field that like never thought about this, never thought they would want to do it. And then my story was like, I wanted to be sports and ortho and I kept running into issues where I was like, this is actually a pelvic floor issue. I have to refer out. So I might as well just get certified in that. And then it became my like lifelong passion, which I'm so glad I did. But like, that doesn't happen to everyone, right? It's like, I don't want to do internal. Like, I never thought that was going to be something I had to do because no one told me that. So we need to really be better about including that in a physical therapy program.
Oh, I totally agree. And I mean, whether it's conversations like this or going to different PT schools and having PT schools, I don't know I was thinking about this for the future. Like if PT schools wanted somebody to come talk to their students about this portion, this specialty, subspecialty, and how you could go into it as, as a practicing PT, I would love to do that. I think that unfortunately it starts at the root of where these kids are, where these students are, and that's in class and that's in school. And if they don't know about it, they're not going to be able to go into the field.
Yeah.
And so I feel like they definitely need to broaden the courses themselves and actually like the subsections of, what they're being tested on. It's not just ortho and sports and neuro, which obviously are the biggest things, right? But, increasing access to vestibular care, pelvic health in general, male and female. I think having larger courses for that would definitely broadens people's just education of what they could go into.
Yeah. And it is weird because we say like, okay, oro. We're filming an oral sex episode later.
We are.
I love that.
But like we say like ortho, neuro, and everything, that's like the biggest specialty. But like really pelvic health is just as much people have pelvic floor dysfunction as they do having like, I don't know, knee pain or like knee OA. Like it's even more, I would say, but it's just not prioritized. So the more we prioritize it, it's going to be up with those big O's up there. I swear.
I mean, how many times do you come across an injury and someone's like, let's look at their back, let's look at their spine. It's like your pelvic floor is just an extension of that trunk area. Like that is going to be like present in so many of our patients that we're seeing in ortho clinics.
Yeah. And just, I think education itself, right? Like I said earlier, half of my patients, when I'm just talking about what I treat, 85-90% of them are like, when I just even mention male pelvic floor. And so just even talking about it, and they're like, oh, I didn't even know that was a thing. I had a guy come in last week who was like, I didn't even know pelvic floor, I had one. Like you were just talking about earlier, right?
Yeah.
And I was like, my guy, you do have a pelvic floor. That's why you're having some of the issues you're having, but it doesn't mean we can't work on it. We can't fix it, you know? And so just even spreading awareness about it.
Yeah. And you're doing internal work with your patients, correct? Because even a lot of male patients that come to pelvic floor, or not to us, we do internal work, but go to clinics and they don't get the internal work, and it's vital.
That's a good point.
And I will say, even just saying like, we might do an internal exam today, the fear on one's eyes, right? I completely understand, especially I will say, unfortunately, as men, just having a lot more stigma involved with their genitalia and what they define as being a part of their manhood. And, you know, crossing that boundary is already a huge step for them. And a lot of them are not comfortable with it. And just letting them know, like, I am what your urologist does when he does a digital rectal exam. This is the same thing. I am a healthcare provider. I do see you more often, yes. But if we need to get to the root of your problem, we need to do internal work as well. And just being very straightforward with that. And so a lot of times just having that part of the conversation usually helps them calm down a little bit. But just reiterating, like, I am a healthcare provider. You're coming in here for my help. This is a part of it. We need to work on this. This is going to be something that is a necessity. And if it works, great. You know, it helps me identify some structures that are impaired and are tight, are weak, etc. And then we can work on those things. If not, it may just take longer because I'm not able to do this part of the exam. But a lot of these guys are just coming in and just wanting to talk.
Yeah.
Jordy just wanting to talk.
That's exactly what it is. Like the first session, especially, like our subjective could go on for the entire time.
Absolutely. And that's where like trauma-informed care comes in. Like if you're sensing from a patient that they need more of that rapport building just to be comfortable with having the conversation, that's something we have to be able to flag as clinicians.
Yeah.
You said something else that made me want to leave a comment for clinicians out there.
Please.
If you are a practicing pelvic floor PT, taking the male pelvic floor course is also going to help with your assessments of cis women, because some of what you described with getting someone a little bit more comfortable with an internal exam for men, you have access to the rectum. So that's going to be the exam that you do. And maybe they haven't had as much of that like internal assessment throughout their life. So it can be a really uncomfortable topic for them. For women, a lot of clinicians will always do a vaginal assessment because women go to the gynecologist regularly. It's an easily accessible area for them. It's easy to wrap your head around, like, oh, I'm going to have a finger in my vagina. That happens all the time. To get someone to be a little more comfortable with a rectal exam that identifies as a woman is also a really uncomfortable topic for a lot of clinicians and patients. And having that experience in a male setting primes you for it so much more because it is your access point, and it gets you more comfortable with like language around it. And obviously it's different from case to case, but I think it's really valuable even if you are working at a clinic where you're seeing mostly cis women.
No, that's a great point.
Hell yeah.
That's cool.
Yeah, I like that.
I like linking things a little bit.
For sure.
I know this episode's about men. That's all we're going to say about women.
No, please.
No, I like that.
There's enough that is being said about men. We can absolutely talk about men.
We tried to talk about male public health on the podcast once, and we got 5 minutes in, and we were like, that's enough of that.
that we were literally talking, and then Amanda goes, "Okay, so we talked about men for approximately 3 minutes.
That's enough.
Okay, lock back in, lock back in."
Anyways,
No, just kidding. It is important. I'm glad you're here. This is awesome. It's a great conversation.
glad to be here.
Awesome.
Oh, actually, quick before I forget this, because I know I'm gonna forget if I don't say it now. I saw on your page a brand that you worked with, Future Method.
Mhm.
Can you tell us about that brand
Sure,
specifically?
absolutely.
Because especially for clinicians that are listening, we have Intimate Rose that we work with. We have Be Well that we work with, and we refer patients to. So tell us about Future Method specifically.
Absolutely. Yeah, truthfully, when I was going through the course, I was trying to find just companies that provide medical grade products for their patients. And Intimate Rose was one of them as well, who I also work with. And then Future Method came up, truly just search. It was an ad. And then I also was like, okay, this is cool. Let me look into this. And so I honestly reached out to the company and I was like, hey, I'm a male pelvic floor provider, LGBTQ plus in the Chicagoland area. I don't know if you work with other providers in this part of town, especially men's health, but I would love to, get more information about your products. And, I'd love to be able to at least have some samples for some of my patients in terms of dilators and lubricants, et cetera. Because again, I'm seeing the LGBTQ plus population in the queer space, for different bowel incontinence, but also sexual dysfunction, right? For individuals that are bottoming as well. Use of dilators can be crucial and important. And I wanted to spread awareness about that. And so I reached out, had conversations with them. They were fantastic. And so I have some of their products, like in my clinic. And it's been great just for demonstration purposes. And
Perfect.
I'm just so excited that I was able to work with them.
We got to get in touch.
Yeah, we do. Their products are great, and they're more LGBTQ plus oriented,
Yeah.
which I really like. So
Cool.
great.
Oh, thanks for sharing. That's awesome.
Worth it for you guys to check it out. And do you have like a link or something? We can include it in the show notes if you want.
Yeah, no, I definitely do.
Perfect.
Yeah,
We'll include that in the
that.
show notes for you guys. Perfect. So we asked you guys on Instagram to send some questions in. So we did get some. So the first question that we have for our pelvic freak over here, Jonathan, is what do you feel like are the biggest barriers to treating men in this space?
It's a great question. I feel, we've touched upon it a little bit.
Yeah, we have.
But I think it's just awareness and letting people know that, hey, this exists. You have a pelvic floor. You're probably experiencing some of these issues. I feel like also for a lot of cases, just incontinence, bladder incontinence, like urinary leakage, urgency. Those are all things that a lot of people experience at various points in their lives. And that there is somebody that they can see for that. And it doesn't have to be something you need to be ashamed of. Just like with bowel incontinence, just like sexual dysfunction, pelvic pain. I know y'all see this all the time too. And so there is something that you can do about this. It's nothing to be ashamed of. You can go see a provider. And I just want more men to know that there are other outlets out there outside of just medications and trying to find a quick fix for things. You can make long-term changes and hoping to continue to spread awareness about that. So
You know how we can spread awareness? We need to go on the streets and just be like asking people like, hey, do men have pelvic floors?
yes,
Like with,
take
like,
a little
TikTok
take some
videos.
microphones.
Do men have
Yes,
pelvic floors?
We do need to do that.
that
we
would be so
should.
fun.
Yeah, we should.
We need
Yes,
to.
sure.
Anyways, great answer. I do have another question. Okay. Do you have any tips on prostate pleasure for bottoming? So for someone that's trialing bottoming, but just isn't really getting pleasure from it, but wants to.
I think the biggest thing I would want to know is how painful maybe the experience is for them, because I feel like sometimes the thought of bottoming and or engaging in that activity, trying to bottom for the first time or continuously trying to bottom, but you're not finding pleasure from it is it's difficulty in relaxing and trying to enjoy the experience because of the pain associated with bottoming at times. And that's where spreading awareness about it and letting guys know that there are other things than just poppers and all the other chemicals that one can use that can make it more pleasurable in the long term. So I would just encourage and want to know, like, if you are having pain with it, that could be why you're also not experiencing the pleasurable aspect of it. And so that's where having some of the dilators that I have, some of my queer patients, I'm like, yes, butt plugs can be great, but there's also medical grade products, like the Future Method I have a glass dilator set and a silicone dilator set, similarly with the other company that I work with. And I'm like, there are protocols for this over the span of 4 to 6 weeks, depending on the size, et cetera, what your goal is. You can utilize this to help you with relaxation, deep breathing, diaphragmatic breathing. Use of dilators a little bit each day can help you have more pleasurable sexual experiences, especially with bottoming.
Yeah. And I'm sure too, it's similar, like, just like for our female patients, if you have a lot of like stress and anxiety and you're like clenching and you're holding on, even if you don't have pain,
Sure.
we have plenty of patients that have difficulty having an orgasm because they just aren't relaxing their pelvic floor and trying to enjoy the experience, right? So like you said, the diaphragmatic breathing, really intentionally relaxing the pelvic floor, even if you don't have pain.
No, it's the same. It's the same thing. I mean, in regard to the relaxation, the stress and anxiety associated with it. A lot of the gay patients that I have that are having some bowel incontinence issues, they express to me that they are uncomfortable with bottoming because of their other issues that they're coming in for. And it's not something they don't necessarily want to do, but they don't feel comfortable doing it. And so because of the tightness and the increased tone of the tissue around the anus, they're not able to have normal bowel movements. They're also just not engaging in sexual activities or not bottoming. And so once we're able to help work on that, once they're able to relax and work on those things, and bottoming can become more pleasurable or an option. So that's something that I'm working on with a couple patients right now, is just relaxation and then use of dilators. And they're now, beginning to participate in bottoming because they are more relaxed and they've started practicing and using the dilators. And I mean, more men can definitely just benefit from that in general. So hopefully, this individual, depending if it's pain or just tightness, can find other ways to help work on that. So maybe he can enjoy bottoming.
Okay.
So.
I'm curious, as a follow-up, what are your thoughts on like short-term fixes for this? Like we had a story submitted once about like a numbing lubricant and things like that. What's your take on all that?
Personally speaking, I could say I have utilized that before myself. And, I think at times it's important to be aware of the sexual experience, sexual encounter you're having, right? You don't necessarily want to void of all pain because that could alert to damage or potential tissue damage, right? And that's obviously super important for both during and after the activity, bleeding, et cetera, STI. You just need to be very cautious of that. So I think just depending on the activity and just the safe aspect of it, it can be helpful, but I wouldn't necessarily encourage use of that for long term. Because once again, you're just voiding yourself of the sensation and the feeling, and that could lead to damage in the future. So again, it's
a good tool, but you don't want to overdo it.
You don't want to overdo it. The same thing with chemicals in the rear space, right? Poppers. Everybody uses them all the time, and that's their way to relax things. And I understand the effects that can have on sexual experience, but at the same time, it's also not a permanent fix for things.
Yeah.
If one can use other devices, other tools, and allow themselves to have the same amount of pleasure, and maybe in a safer way, why not?
It's kind of the queer equivalent of like, just have a glass of wine and then try it out.
Yeah, literally.
Wait, literally. So true. Well, we do have one more question that we got submitted to our form, and it is it possible for a gay male bottom to be loose or too loose?
I think with that question, right, it depends on what one identifies as loose, right? I think it's all about the partner and the sexual encounter that you're experiencing, and hopefully the sexual encounter that is, you're not, just with an individual that would even want to say that to you or make you feel uncomfortable with, your genitalia and the experience that you're having. Sure, if one is engaging in a lot of sexual activity, and depending on the tone of the muscle, you do the same thing over and over again. Sometimes you can lose some elasticity in the tissue, and at the same time, things can become weaker with time. And so, yeah, if you're not maybe engaging in just regular physical activity or exercise and or doing Kegels, like we're all aware of, you might not have just as much strength within your tissue, and that could lead to other things as well. So I would say the term loose I don't necessarily like it, but I understand where one is coming from.
Yeah.
And, I think it's just, you do the same thing, you're engaging in these activities. Yes, you can be stretching out tissue, and at the same time, you just want to make sure you have strength in that tissue as well.
So it's pretty much just like not an idea of loose. It's like weakness is possible.
I would say weakness is possible as well, especially with the sphincters around the anus, within the anus and the rectum. Like those tissues, when you're bottoming repetitively, you are gradually stretching out that tissue over time. And at the same time, if you're not, doing Kegels or things to help contract or, strengthen those muscles that strengthen your pelvic floor, that are your pelvic floor, that strengthen the sphincter, gradually things can stretch out. And I would just be cautious of that too, right? Because it's your anus, it's your rectum, you're having bowel movements, and sometimes that could affect those as well. And so weakness, elasticity, those things can affect the tissue. But at the same time, I'd say loose is a word of, if you feel like you are you experiencing other things? Are you
like
just
if you're having more bowel incontinence
issues, like or just increased production of gas? Like, are you unable to just have normal bowel movements, or having it more often? Sure, maybe that can be considered the term loose, but at the same time, I wouldn't be hung up on that word.
Okay.
Yeah, personally speaking, not a fan.
Yeah, we don't love it either.
Yeah, we
It's
don't.
usually for a lot of our patients, it's coming from that like people pleaser mindset too.
Yeah.
They're not actually considering what the feeling is for them. I have a follow-up now because I think
Please.
this will be interesting for people because we spend a lot of time with cis women patients educating on like what tightness should feel like during sex because they'll come in saying like, oh, I don't feel tight enough or I feel loose. And we're often saying like, if you feel tight and it's like uncomfortable during sex, you're probably not turned on enough. With anal sex or anal play, what is your like educational blurb on that? Like, are you supposed to feel that like give from the muscle, that tension, or are you wanting your patients to like be able to breathe into it, relax a little bit more? Like for clarification purposes,
Sure.
like, how does it differ from what we'll tell a female patient?
That's a fantastic question. I will say with anal play, you definitely want to use lubricants. I just put that out there just because it is an area of the body that is supposed to be tight, right? It is supposed to hold certain things in, anus, rectum, your bowels, your fecal matter. It's meant to be tight for a reason to allow you to have normal bowel movements. Now, it does not mean that it can't relax and stretch. It is a muscle. And so I think just being comfortable in the setting that you're in, using lubricants and not trying to just do something I hate to say the word raw dogging life, but not just trying to do something like that where you're just trying to go for it, because if you're not used to it, it's going to be painful. It is meant to be tight. So definitely doing things to prepare yourself, breathing, trying to breathe into it, trying to relax, using things that can help relax the muscles, being present in the activity, right? And just feeling comfortable with yourself. I think it'll help make it more enjoyable. Yeah, it's a muscle. It's supposed to be tight, At the same time, doesn't mean you can't stretch and breathe through things and can be enjoyable. So just letting patients know that it is something that can be improved. It can be enjoyable. It can be pleasurable. You just have to have the right tools to do that. So
We talk about lubricant all the time.
Do you have a lubricant that you like? My favorite is Uberlube.
The hand up?
I
love
also
it.
love Uberlube.
I love Uberlube.
I love Uberlube. I think just in the greer space, silicone-based lubricants tend to be the best.
Yeah.
Especially for anal play with men. It's just, yes, it's messier, but it's more efficient and it makes the process smoother.
It's so good.
It is. It
And
is.
they have a sexy little bottle with it.
They
I love the
do.
Uberlube branding. Uberlube. I just said Uberlube. I got my mind on the jewelry heist.
Uberlube. Hello, jewelry ice. Jesus.
Silicone-based lubricants all the way.
Okay, cool.
Something I was just thinking about, I know we're doing the Q&A, that I didn't even talk about yet, but like penis pumps and penile rings.
Yeah, tell us about
I
it.
was just thinking about that. I reached out to another company earlier this week, or a urologist office I worked with, because I don't have recommendations for those yet. And I'm still trying to find kind of medical grade products, or at least ones that I feel like have a little bit more research to back their product itself, whether or not they're like gel or a durable silicone or metal, just bring more awareness about those. And even, I would say any of my male patients, a lot of them don't, like, it's taboo for them to even bring up in regarding ED. Obviously, that's an uncomfortable place to be, right? And that they're trying to find medical treatments, medications to use, but then also we're talking about, the physical side of things, how, increasing blood flow circulation, improving the strength of the muscles, around the base of the penis, that can help improve, the ability to get and maintain an erection, but also being like, there are also other things. And whenever I bring up like a penis pump or a penile ring, it's like I said, it's like a ghost just appeared in the room.
It's like, whoa.
Yeah. Obviously more so maybe in the straight edifying patients.
For
It's
sure,
like,
yeah.
whoa, I don't need that. What are you talking about? But at the same time, you're already coming to see me for this. So this is a safe space and there are other things. And in an odd way, I've enjoyed like explaining that these things exist and like just telling them like, hey, you don't have to be ashamed of this. Like pull up on my computer, different types of penis rings, cox rings. And I'm like, silicone, you have gel. And they're like, oh, interesting. And then, you can see that they're like, there's a little bit of a glimmer of hope that maybe there's something that can help them.
Yeah.
That the medication hasn't helped in 5+ years. And so, yeah, I'm in the process right now of just trying to find companies that make medical grade products so that I can be like, hey, yeah, I actually do recommend these things. Instead of just being like Googling.
Let us know.
Let us know when you do.
Yeah.
Do you have any other resources that you want to share with the pelvic freaks that we didn't touch on today?
Not explicitly. I mean, I feel like the most important thing is just awareness and access to all things pelvic health, and just letting them know like there are products and things that you can use. You don't have to just rely on going to a sex shop, which are fantastic. But even then, right, you can be overwhelmed with everything that's in there and you don't know what to use or what to pick. And so at least having a provider that is comfortable enough to recommend things that even if they don't use the products they're recommending, at least you're spreading awareness of what this is, what it's used for, and they can go do some research on their own now that they're empowered to have this information and be like, you know what, maybe I will look into this. Maybe I will get one.
Yeah. I love showing patients products because at first they're always like, this is interesting. I'm looking at vibrators with my PT right now. But then it's like, oh, okay, I understand.
Yeah.
Yeah, because like I've walked into a sex shop and been so overwhelmed by the options. And I'm like, I don't know what's best for my body. I don't know what that is.
Correct.
Like it's amazing to have a space where you can talk about that with someone in advance. And then the sex shop part is fun and it should be fun.
And to that point too, I've even been thinking about like maybe I should go into these sex stores that are within the neighborhood that offer these products and just go look around and see what they have. And so that, you know what, hey, not saying I want to fully recommend this, but at least I have an understanding a little bit more so as a provider, like, yeah, there are these other products that I had no clue about. You know, now that I'm learning about this, now that I'm treating patients for this, I might have, you know, a different eye when looking at these things that I can help explain to my patients. Like, hey, there's this, and this that are worth maybe trying as well. So,
Okay, this question isn't on here and we don't have to answer it, but what's your like favorite sex toy?
I would say a prostate massager. Definitely one that vibrates for sure. It can be super pleasurable, obviously. And then it's kind of like, you know, obviously the foreplay associated with that, engaging, you know, prior to having anal sex, I think is fantastic.
Do you have like a specific place where you buy or no?
No, not since I moved here, to be honest. I need to do more research.
Okay.
More research about it, but that's one thing I go to a sex shop for.
Yeah, there we
look
go.
around and
There we go.
see some other options.
Yeah.
Because once again, I think part of prostate massage and the pleasure associated with that is being comfortable enough for anal play and allowing yourself to relax enough to enjoy what that product is. Which kind of like to your question earlier is are you relaxed enough? Are you able to enjoy that? And also maybe the person that reached out might want to consider using a prostate massager or at least to see if that helps them relax too.
Such a good idea. There we go.
Love that.
Look at us.
Look at us brainstorming.
We are.
Look at us.
That's why conversation's important.
Absolutely.
Well,
Here's the thing.
it looks like we're coming up to your guys' favorite segment. I don't know if it's your favorite. It's my favorite segment. And it's a bit called Here's the Thing.
Yeah.
So we're going to go around and we're going to say, here's the thing. And we're going to share our hot take. It could be from this episode or it could be in life. Amanda, would you like to start?
You know I hate this. Here's the thing. Sex and pleasure should be fun. And if you feel like you're not having fun and there's a safe space for you to talk about that so that you can have more fun, you should utilize it.
Would you like to go next?
Sure.
Okay.
I've been thinking about this too.
Okay, cool.
Here's the thing. For men, what's more, I would say, I don't want to say the word embarrassing, but what's more uncomfortable? Not seeking out help for the problems you're having or simply having the problems like erectile dysfunction and incontinence for the remainder of your life, right? If you're enduring these things or if you're experiencing them and you have for so long, there's help for it. And you shouldn't be embarrassed to try to seek out that help so that you don't have to do that for the rest of your life and that there are outlets to do so.
Yeah.
So don't be embarrassed.
So
Love
good.
that.
So good.
Here's the thing. You guys should all know that men have pelvic floors.
Exactly.
You're going to see us on the street and we're coming for you. We're coming at you with a microphone. We're going to say, do men have pelvic floors? And you're going to say yes.
Better say
And if
yes.
you say no, you're going to be on TikTok. All right.
Wow. John, after this episode, I think I have to throw this shirt away because I think I have met a man.
The intimidation factor of sitting across from you and being like, I've literally never met a man.
Hannah bought me this shirt, by the way.
Yeah, well,
It's very Amanda coded. If the more you learn about her, you'll understand.
it's a fantastic shirt.
Yeah.
Well, thank you so much for being on the podcast with us.
Thank you
You
guys for
did
having me.
fantastic.
Thank you.
And we are so excited to present this to the Pelvic Freaks. Would you like to share your Instagram handle where
Yeah.
people can
Yeah.
find you?
Absolutely. My Instagram handle is Johnny K, JONNYK_. I've had it for way too long, and I probably should change the name.
Where can people find you if they're in Chicago and they want to come see you? Because I know we mentioned it at the beginning, but just as a recap.
Sure. So I'm at Athletico in Andersonville South. I think it's actually 5033 North Clark. Yeah, I treat ortho sports, but also predominantly male pelvic health as well. And please don't hesitate to reach out if you have any questions, comments, or concerns.
Aye.
I'd love to help you all.
All right, pelvic freaks, that's it for today.
Yes, thank you guys.
We do a closing and we say bye, pelvic freaks. So if you would like to initiate that, you can say bye to our pelvic freaks.
Bye, pelvic freaks.
Bye, pelvic freak.
Bye, pelvic freaks.